Hi, I'm Allison Carter, and this is Kayla Mutter. We will be talking about the psychological effects on children with siblings that have pediatric cancer.
Siblings of a pediatric cancer patient are known to have increased depressive symptoms, more anxiety, and worse peer relationships as compared to the average sibling. It is sometimes said that when one family member is told they have cancer, it is as if an entire family is diagnosed with the disease. Cancer is a disease where abnormal cells divide uncontrollably and destroy body tissue. Childhood cancers make up less than 1% of all cancers diagnosed each year. About 1,180 children younger than 15 years old are expected to die from cancer in 2018. Because of the major treatment advances in recent decades, more than 80% of children with cancer now survive 5 years or more. In the mid-1970s, the 5-year survival rate was about 58%. The most common types of cancer found in children are leukemia and brain and spinal cord tumors.
A study completed by the Medical College of Wisconsin using 265 children from ages 8 to 17, some in active treatment, completed treatment, and the siblings, were tested to find their family relationships and psychological status. Siblings had worse family relationships than patients in active treatment. The family relationships of the sibling were impaired when their own depression increased. When the cancer patient was younger and female, had less depressive symptoms, and had more anxiety or a diagnosis of leukemia or lymphoma, then the siblings' relationships were impaired. Children with cancer can experience decreased physical, emotional, and social health-related quality of life compared to healthy children. During cancer treatment, siblings are overlooked family members, and up to 63% can have adjustment difficulties.
There was a study that showed that the siblings of those with pediatric cancer experienced more anxiety, depression, and worse relationships with those around them as compared to those siblings with healthy brothers or sisters. Some siblings reported feeling lonely and having decreased attention while their brother or sister is undergoing cancer treatment. The siblings may cognitively understand the illness and its increased needs depending on their age, but can still have impaired social and emotional health-related quality of life. Even as far as 2 years after the child completes cancer treatment, their siblings' emotional and social problems can continue.
Interestingly, sibling-family relationship scores improved when the child with cancer experienced more depressive symptoms. Early findings show that 60% of siblings in one particular study demonstrate PTSD symptoms, and it is believed that some will continue to have behavioral and emotional difficulties in the future.
One father said, "I knew that we were going to have to neglect her for that time, and it made me feel horrible." A sibling reported that they understood that a part of their parents' heart for them had to go to the child with cancer. Siblings of children with cancer have reported feelings of guilt, isolation, jealousy, fear, anger, and sadness, among many others. Siblings do not know how they are supposed to react when someone they love is diagnosed with cancer. A sibling reflects on their own experience with his brother being diagnosed with cancer. "But when Dave was diagnosed with cancer, I found myself at a loss. This new threat was something I never experienced, and no words of wisdom could fix this problem."
Ryan Rose Weaver, a popular blogger, talks about her experience as an adult sibling with a brother that has cancer, saying, "For a protective perfectionist, problem-solving sibling, feeling helpless in the face of a loved one's cancer is the ultimate psychological torment. On good days, I feel guilty for being free to have fun while he's feeling down. And on bad days, I feel overwhelmed by sadness and fear on my brother's behalf." She did some research and found this to be true with a lot of siblings. The healthy siblings experience guilt for not being the sick child or grieves the loss of a normal family due to the emotional trauma.
Justin Ashcraft, a boy diagnosed with leukemia when he was 9 years old, became paralyzed and lesions began to form on his brain. Justin passed away at 19 years old after battling cancers for 10 years. Towards the end of Justin's life, his brother reported that he was clinically depressed and started to get help when his wife noticed the differences in his behavior. He didn't tell Justin or his family because he didn't want to bother them because they have other things to worry about. This story is just one of many that show the effect of a child with cancer has on their siblings. The film series about families' personal journey is called A Lion in the House and can be found on PBS. People don't realize that a sibling's mental health is affected when a child has cancer, but this is the case for many families. People don't realize that the sibling's mental your foot. I stroked your foot. People don't realize that a sibling's mental health is affected.
I'm sorry.
What was that?
What?
Are you ready? Justin Ashcraft, a boy diagnosed with
You're having a little issue with this one.
Leukemia.
Leukemia?
Okay, I'll get it next time, I promise. Justin Ashcraft. Okay, Allison.
I like looking at myself.
Dave was diagnosed with cancer. I found myself at a loss. This new threat.
Stop. Interestingly,
You had it.
I know.
Hi, I'm Kayla Mutter, and this is Allison Carter. We will be talking.
The way you say
Why? That's your name.
No, the way you say or lymphoma. Then the siblings' family relation. What? That makes no sense.
On children with siblings that have pediatric cancer.
Do you want to do that again?
Sure. Does it look better?
Hold on. So now you're going.
So what do I say?
So, okay, you just start whenever.
Okay.
I can't. Okay, I'm sorry. I can edit this out, so it's fine.
Hi.
No, don't.
No, what do I say though?
Just
Like,
say
just
what
hi?
you wrote.
Hi, I'm Kayla Mutter, and this is
literally
Allison.
You can tell